I mean, is anybody here a doctor? Anybody here my doctor? Anybody here my doctor? So nobody has a right to tell me that I have to put a medical device on my face. Think about that. It's under emergency use authorization. Why is that? Because there's no evidence that it works. And in fact, those masks don't work. And I don't know what that box says. Is there anything on that box that says
It
it doesn't,
it doesn't work.
doesn't protect against viruses?
That's what it says. That's what most of them
It's been over a week that the CDC has declared them
non-medical.
ineffective.
Okay, but so if it's non-medical, right, I mean, you have to wear a respirator in order for this to protect you, right? And it's just the breathing, just the actual breathing that causes the spread. So that's number one under emergency use authorization. The testing is under emergency use authorization. So nobody has a right to tell you that you have to get tested to participate in society, especially when we know it's an experiment. Number three, all of these shots, they are not vaccines. Stop using the term vaccine. They are not. It's gene therapy. It's gene therapy. These are not vaccines. What else about them? All of them are under emergency use authorization. My question to the board is, I don't know, because I go to a lot of these meetings, do you have these clinics? Do you put out information on the website about these shots? And if you do, are you telling the people in Randolph that these are experimental? They're experimental. There's nothing about these that have been approved by the FDA. They're approved by the FDA for emergency use authorization. So to as a board, to get people, because they all think that you guys know. And if you're not telling them that these are under emergency use authorization and they're experimental, and they're giving them to children, pregnant women, the guy in the hospital in the Brigham, he knows that he is at a high risk of myocarditis, of a heart attack, of blood clots, and strokes if he puts this in his body. So now, I'll just give you a little snippet, because I've actually been leading the charge with that guy down there in the Brigham, David Ferguson. He was told on Thursday by the transplant team that if he didn't take this poison dart, he would not get his heart. And I think he was second on the list. On Friday, they went in and they said to him, if you take this poison dart today on Friday, you could probably have a heart by Monday. Okay? On Friday, and if you're the doctor, you know what a balloon pump is. On Friday, they put a balloon pump in. By Sunday, his right ventricle failed, and today he had an LVAD put in. So this guy kicked off the transplant list because he wouldn't put an experimental gene therapy shot in his body. The last thing I'm going to say, and I don't know anything really about Randolph. I follow a lot of towns. I just haven't gotten to Randolph. My question is, if you are pushing these injections on people in Randolph, are you aware of MGL Chapter 111, Section 181? Is anybody in the room aware of MGL Chapter 111, Section 181? Anybody?
No.
Okay, what is that law that's on the books? It says that boards of health, if they deem necessary, I'm just paraphrasing, they can actually tell the inhabitants of their town that they have to take a vaccine or get revaccinated. Did you guys know this?
No.
Nobody in Massachusetts talks about this. Nobody talks that there's a law on the books in Massachusetts. So my question is, I think I know why nobody brings it up, because the last sentence of that law says that if an inhabitant, I'm paraphrasing, doesn't comply with the law, they will actually get fined $5. So there's a law in the books that, in my opinion, the boards, people on the Board of Health should actually alert their citizens to let them know that they don't have to take this if they don't want. Let them pay a fine of $5.
Oh,
So if you're not
so
giving,
Boston, they should
if
go
you're
pay
not giving the
$5?
people the information then honest to God, and I'm trying not to be rude, you're actually hurting people. When you're not telling them that these injections are experimental, when they believe you, cause you're a doctor, they do, and they bring their little kid,
Let me correct you. Thank you for the MD degree, but my PhD is in public health.
okay, they're not experimental?
And no, I didn't say that. I said, thank you for the MD, medical doctor degree. You called me doctor.
No, him, he's the
I'm
doctor.
not a doctor
He
either.
didn't-
Oh, I thought you said he was a doctor.
No.
So where's the doctor?
I thought he was a Dr. Kaplan, I thought, but I don't know.
Oh, no, I
It's on
thought
the
he,
letterhead.
no, sorry, so
All right.
I thought he was a doctor, but the point is, if you aren't telling the people the truth, you're actually hurting them. And what I've been encouraging people is to sue members of the Board of Health when they give the wrong information to people. So that's what I'm saying, that you guys are potentially liable, because this guy right here told me I had to put a medical device on my face. He doesn't have that authority. I'm sorry, you don't. You do not have the authority. You don't. Whether you like it or not, you do not. Anyway, that's it. Diana Ploss, thank you.
Thank you for your.
I do have a double master's in nursing, just so you know.
Mr. Chairman,